Now, we've seen the biggest number of deaths in a single day here in South Africa. 111 COVID-19 related fatalities brings our death toll to 2,102. Well, however, progress seems to be made as there's great excitement about the country's participation in the COVID-19 vaccine trial. Let's chat more about this now with Professor Adrian Puren from the National Institute for Communicable Diseases. Adrian, good morning. Once again, yes, we find ourselves talking about vaccines. Much excitement about this one. We know that Wits announcing South Africa's first COVID-19 vaccine trial and the first participants to be enrolled this week. What do we know about how this works? Who will be eligible to take part in a trial like this? Let's start there.
Yes, absolutely. You've just made the point. You know, we're seeing increasing numbers of death, and this may well overwhelm our system. So getting a vaccine in order for us to have what we call herd immunity is really essential. So this particular vaccine is part of a broader international vaccine trial, and as you know, it started off in Oxford, and it's called the ChAd-OX1. It's a chimpanzee-based adenovirus which has the spike protein within it. In order for when you inject this particular vaccine, it then synthesizes the spike protein of the coronavirus, and that is seen as foreign, and you have an immune response to that. The type of immune response, I think, will be critical, and that is certainly going to be measured as well. And we're looking for what is called efficacy. And I know that I'm not sure for this particular trial what the efficacy is, but it's about 50%. So if you get 50% efficacy, then that will be really useful. And you're quite right, who's going to be enrolled in this trial? So I think there will be about 2,000 participants that will be enrolled. It will include both HIV-negative individuals and HIV-positive individuals, because again, as you know, we certainly have a large population of HIV-infected individuals. And so how will this particular vaccine behave in that particular population? And it will be set in high-risk areas, obviously, where we know that the risk of COVID infections are going to be high.
Okay, so this will start from today, going into August as well. Just a broad idea of what they will actually be put through. Are we looking at people who are perfectly healthy, who will be injected? And I know it might sound like a very layman question, but that's the picture that comes to mind, is somebody being injected now with coronavirus to see what happens. What exactly will they be put through in the next couple of weeks?
Yeah, so this is what we call a randomized controlled trial. In other words, individuals will be randomized either to the vaccine that contains the coronavirus spike protein that is produced and a placebo. And they'll be injected and monitored and tested over time. And the endpoint obviously will be that they start off as being coronavirus negative. In other words, they've had no exposure, so they obviously will have to be tested beforehand and then followed sequentially to determine whether they become infected. And then you can compare your control arm, which has had if you like, the placebo, it's another vaccine, and versus the individuals who receive the actual vaccine. You do what is called a rate ratio and see how effective this particular vaccine has been in terms of protecting individuals. And that will go through, I think, a few months in terms of monitoring. Because, again, we're not clear what the immune response will be like. So it'd be important to know if there are responses, what are those responses in terms of neutralizing antibodies, and what's the durability? Because if it's of short durability, then obviously it's a matter, as we do for the flu vaccine, you may have to receive multiple vaccinations. So
I'm assuming that this is just a once-off, I'm going to call it a shot that they're given, or is it something that is going to be done consistently in this time period?
So from the description that I have currently, it looks as if there'll be a one shot, and I think there may be different doses that will be used, and then the monitoring thereafter. But sometimes you're quite right, in vaccine trials, you may receive multiple doses in order to achieve particular efficacy as well. But it looks as if in this particular trial, you receive a single dose and then are monitored in terms of whether or not you will develop the infection or not.
And what are the precautions, Adrian, that have to be taken in this time, to prevent somebody now from dying from being part of this trial?
So this will be critical because, again, a randomized control trial is because we don't have any effective intervention. And so, yes, there are risks, but I would assume that because, again, we're going to enroll individuals between the ages of 18 to 65, And so I would assume that there will be risk management. In other words, you'll be fairly healthy to be enrolled in this particular trial, but still have a high risk, and those will be managed. In other words, if you do become more severely prone to becoming ill, then that will obviously have to be managed appropriately. But I would assume that those who are enrolled will be healthy individuals, not at high risk in terms of comorbidities and so on.
All right.
So I think that's the other question around, again, the concerns may be, well, if you've chosen those, we know that there are individuals with high comorbidities, for example. So how will the vaccine behave in that particular setting? But I think my understanding now is that these will be focusing on healthy individuals in order to minimize those risks with comorbidities and poorer outcomes. Yes.
And of course, all of this happens in an isolated facility?
No. So you'll be vaccinated, and you'll just go back to your usual duties, in other words. But obviously, focusing again what we'll be messaging, in other words, even though you are in a high-risk scenario, you still need to practice the physical distancing, the hand hygiene, cough etiquette, all of those things to protect yourself from becoming infected. So even though you've been vaccinated, those are still the key messages that you will have to do in order to protect yourself from becoming infected.
Okay, so it's going to be a very nail-biting couple of months for people in this trial, this vaccine trial. Thanks very much. The NICD's Dr. Adrian Puren making sense of it all for us as usual.